with any pupil exam, I'm looking at the eye that I'm shining the light in, but as importantly, I'm looking at the eye that I'm not shining the light in, making sure there's symmetry, no afferent pupillary defects, or problems with constriction or dilation. Normal pupil exam, you're doing great. With your eyes, I want you to follow my finger, okay? Okay, so like, and we're checking all positions of gaze. And it's okay, I'm just gonna gently lift your eyelids up. And so what I'm gonna do here is just to make sure that they can move their eyes all the way down, I'm gonna hold the upper eyelids up just so I can get a really good view. You're doing fantastic. And now I want you to tell me is that as bright as that?
Yes.
Okay. If the patient's to say no, it's dim in one eye versus the other, there's a couple ways to kind of try to figure out how much loss there is. It's a subjective test, but I like to say things like, okay, if her right eye is the one where she says it was dim in that eye, say, okay, if that's 100% brightness, what percentage of brightness is that? And they'll give you a number like 75% or 50%, and that's just a way subjectively to check it over time, okay?
I'm going to start with visual fields, okay? Just look straight at me and point to the hand that moves. That's great, and just cover one eye for me. Just keep looking at me and just say yes when you see my hand moving.
Yeah, 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 yeah.
Great, with the other eye?
Yes, yeah, yeah, yeah.
That's great. And let's look at your pupils. Just look straight ahead for me. Direct reflex is okay. Indirect reflex is okay. Direct reflex is okay. Indirect reflex is okay. Just going to have a look at your optic disc. You just look at this target here. Okay. Just look straight ahead. Fine. Optic disc is fine with venous pulsation. Just look straight ahead for me. Optic disc is fine. That's fine. Then just look straight ahead for me. And then just follow my finger with your eyes and tell me if you see double. And just look up, look down, look across, look up, look down. That's super, okay. Now just close your eyes tight, real tight. Don't let me open them. Super.
Beautiful. Come on in, put your head right in the chin rest, forehead on the band. Are you comfortable? All right, open big, look straight at me. There's going to be some bright lights. Just open big, look straight ahead. Perfect, excellent. All right, very good. Now I'm going to take a look in the back of your eyes. It's going to be a bright light. Hold nice and still, look straight ahead there for me. All right, very good. Sit back for me.
I'm just going to put it over here. Good. And swap over, the same thing. That's fine. And just 1, 2, perfect.
Go ahead and cover one eye for me. All right, and then cover the other eye. Excellent. And now I'm going to shine a light in your eyes. Just stare straight at me. Very good. Now I want you to focus on this pen light with your eyes and then look at the wall behind me. Then look at the pen light. And then focus on the wall behind me. Excellent. So your pupils are equal, round, reactive to light, and accommodation, which is what we're testing with this pen light here. I'm just going to lift your eyelids. Your eyelids look normal. Sclera, conjunctiva, iris, all within normal limits. Your sclera are white, no conjunctivitis. All right, so I'm going to take a quick look with my ophthalmoscope here. So we're going to test your red reflex. Just going to shine this light here. All right, very good. Look on both sides. Okay, we're going to look up close. So your Optic disc is visualized with sharp margins, no exudates or erythema. I'll work on the other side. Alright, both sides are equal. Excellent. Alright.
I want to test your peripheral vision. I'd like you to cover up your right eye with your right hand. Okay? I'd like you to concentrate by looking straight at the center of my eye there. Keep looking here, and I want you to tell me when you see my fingers move.
Yep. 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 Yep.
Okay, can we swap eyes now? Okay, now look straight at my eye again, please. Just say yes when it moves.
Yes. 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 Yes.
Okay. Next, I want to look at the back of your eye through this ophthalmoscope. I'd like you to look out into the distance at the clock there. Could we dim the lights, please? Could you keep looking at the clock? I'm just going to look at the back of your eye. And if you could keep looking out at the distant clock. Thank you.
So I'm just gonna feel around your eyes, okay? Touch your lacrimal ducts. I'm just gonna look in your upper and lower lids. You haven't noticed any drainage, any discharge of any kind, have you? No pressure, no pain like that?
Nope.
Okay. Great. So what we're gonna do for this next part is I'm gonna have you hold this card out about 14 inches from your face. You're gonna cover your left eye, and I want you to read the line that you can, the smallest line that you can read, okay? But do you wear glasses or contacts? Okay, great.
LTFPH.
Great, now switch and do the same thing with the other hand.
LTFPH.
Great, now we're gonna do it with both eyes open.
LTFPH.
Good job, thank you. So for the next exam, what we're gonna do is I want you to look directly into my eyes, okay? I'm gonna hold my fingers, I'm gonna wiggle them around the periphery. I just want you to tell me where exactly you can see them if you can, okay?
The top.
Okay.
The top. Bottom. This one. Bottom. Bottom. That one.
Great. Thank you. Next, I'm going to take my pen light here, and I want you to look at this, and then look at the, look at my pen light, and look at the wall. Great. So next, you're going to follow my pen light, okay? Thank you. So I'm just shine a bright light into your eye, just look right on my nose. And for this part, I would also dim the lights, okay? I'm gonna shine a bright light into your eyes, okay? Just looking at all the eye structures, okay? I'm gonna look at your left eye. Okay. Wonderful. No problems with that? And no complaints with your eyes?
Nope.
Okay, great.
Just stare again at that spot. Blink anytime you need to, but keep staring at one spot. I apologize for my sandwich breath here. Very good. Looks great.
So first, can you mirror me? And let me know when you see my finger in your peripheral vision.
I can see it.
Perfect.
I can see it.
Good. And we'll switch eyes here.
I can see it. I can see it.
Good. And then can you please follow my finger with only your eyes, not with your head, okay? Any dizziness with that? It was comfortable? All right, I'm gonna shine a light in your eyes. Can you tell me if it's too much for you or if it hurts at all? Good. Now the other side. Good. And do you see an eye doctor regularly?
I've never had to see an eye doctor.
Do you have any glasses or contacts?
Nope.
I'd like you to open your eyes wide and focus straight on my nose. Good. Great. I would like you to focus on my finger and follow my finger without moving your head. Open your eyes wide. Okay, I want you to follow it in. Okay, very good. I'm going to ask you to look at that point right there on the wall while I take a look inside your eyes. Okay, let's take a look inside. Good. Once again, keep looking at that point. Okay. I want you to look up. Okay, good. Now, do you have any problems seeing?
Okay, can you please look up? Good. Now go ahead and look straight behind me again. Good. Can you please look down? Great to lift your armlet. Okay, perfect. And I'm going to check your other eye. So go ahead and look behind me. Okay. Can you please look up? Okay. And now go ahead and look down. Okay. And now go ahead and look behind me again. Okay. Good.
And look directly at me, okay? Okay, fantastic. Next, can you look straight ahead?
Yep.
And I'm going to put my fingers in front of you and look at my fingers when I ask you to, okay?
Okay.
Look at my fingers and relax. Look forward again. Great. Next, we're going to assess your visual field. If you can cover one eye for me, and with that, I'll be moving my finger around whilst you focus your gaze at me.
Okay.
Just let me know when you can see my finger.
Okay.
Okay? Fantastic. Let me know when you can see my finger.
Yeah, I can see it.
Fantastic.
I can see it. 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 Yeah, I can see it.
Fantastic. And the same with the other eye, please.
Okay.
Just let me know when you see it.
Yeah, I can see it.
I can see it. I can see it. I can see it. I can see it. I can see it. I can see it. And I can see it.
Great. We're now going to assess your blind spot. Okay. This will involve me moving the stick whilst you focus your gaze at me.
Okay.
As I move it around in your field of vision, the tip should disappear.
All right.
When this occurs, let me know. Okay?
Yeah.
Fantastic. If you can cover your left eye for me, please, and move a bit closer. Just let me know when it disappears.
Okay, it's gone.
And when it reappears.
Okay, I can see it. I can see it. I can see it. And I can see it again.
Fantastic. And the same with the other eye, please.
Okay.
Just focus on me.
Okay, it's gone.
And when it reappears.
Okay, I can see it. I can see it. I can see it. And I can see it again.
Fantastic. Relax. Next, we're going to look at the back of your eye.
Okay.
This will involve me shining a bright light into it and coming quite close to you. Would that be okay?
Yeah, that's fine.
Fantastic. Okay. If you can come close to me, please. Okay, look up for me, please. And look down. Look left. And look right. Great. And the same with this eye. Look up for me. Look down for me. Look left. And look right. And straight ahead.
So I want to ensure that my patient is comfortable at the slit lamp. So chin in the slit lamp, head get all the way against the bar. And then I'm going to ensure that the black bar meets with her lateral canthus. I'm going to turn my power on and my light source on. I'm going to have you look just straight ahead. I've placed my filter on and I have a broad width of my beam, adjusting my pupillary distance. I'll swing my light source out, and I'm just going to start by looking at her lids and lashes and conjunctiva. So if you can look to your left, please, and then to your right, and then all the way up. Good. You'll feel my finger on your bottom lid as I would just retract down, looking at her conjunctiva, and look down to your toes. Looking at her top lid, retracting up. And now look straight ahead. And I'm going to increase my illumination, my magnification, decrease the width of my beam, and I'm going to increase, or I will remove the filter, increasing the amount of light. I'm going to, with fine movements, sweep across the cornea. And now I'm sweeping across the iris structure and focusing back into the lens. In order to view the anterior chamber, I will decrease the height of my beam to 1 millimeter. I'm going to increase my intensity of the light all the way to its highest setting. I'm swinging my light source out even further, and I'm focusing from the posterior surface of the cornea to the anterior surface of the iris, looking at that space. And then I will remember to decrease the intensity of my light. Swing my light source straight on. I'm going to decrease my magnification. I'll increase the height of my beam. And now I've got a red reflex through the pupil. In order to view the posterior structures, I'll instruct the patient to look at my opposite ears. So I'm looking at the right eye. I'll tell her to look at my right ear right here. And that will bring the optic nerve into alignment through the pupillary axis. Again, I've stabilized my elbow. I've stabilized my fingers on the forehead bar. I have my red reflex. I'm going to drop my lens down into that axis, viewing axis, pull back to focus to the posterior segment. I've found the optic nerve. I can increase the width of the beam if I need to. I'm just focusing across the macula. I'm following the retinal vessels. And it's important to remember that when we view with our lenses, it is the opposite and reverse view. So superior vessels are actually viewed inferiorly, inferior vessels superiorly. Same with nasal and temporal.
Now, again, using your left hand to cover up your left eye, I want you to look straight into my eye. Keep looking into my eye, and using your peripheral vision, I want you to tell me when you see a finger wiggling coming in. Okay.
I can see it.
Yeah.
Yeah. Yeah. Yeah. Yeah.
Thank you. Can you swap eyes for me? Good. And if you look straight into my eye, keep looking into my eye. And again, using your peripheral vision, point at the finger that wiggles for me. Good. That's great. Thank you very much. I want you to look straight away, far off into the distance now.
Yeah.
Keep looking off into the distance and try and ignore my finger. And now look at the tip of my finger. Thank you very much, and follow it in. Thank you. That's marvellous. I'm just going to shine a light in your eyes, if that's okay.
Yeah.
I want you to again try looking straight forward and try and ignore my light. Thank you. Ipsilateral and consensual. Ipsilateral and consensual. Good. And now looking for a relative afferent pupillary defect. That's great. Thank you. At this point, I would normally perform fundoscopy. Now, what I want you to do is look at the tip of my finger for me. Keep your head very still and just keep focusing on the tip of my finger. Follow it with your eyes and let me know if at any point you see double. Okay.
Double. 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 Double.
Good. And we'll just go straight across the centre again. Okay.
Double. Double.
Good. Thank you very much. That's marvellous.
Have you look up for me? Okay, conjunctivitis, pink and moist, glare is trying to white. Alrighty, now I'm going to have you do a confrontation test. So just cover one eye for me and just let me know every time you see my finger.
Yes. 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 Yes.
Okay, good. Now the other eye.
Yes. 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 Yes.
Okay, good. Thank you. Cranial nerve 2 is intact, and you have good visual fields. Your peripheral vision is within normal limits, so that's good. Alrighty, now I'm going to do the Snellen test. So I'm just going to have you read the smallest line, read the smallest line possible for me, and then cover one eye.
Alright, 374258.
Okay, and now the other eye, please.
374258.
Okay, good. So with that being said, cranial nerve 2 is intact, and you have 20/30 vision. So what that means is you see at 20 feet what the normal person sees at 30 feet. Okay. Now I'm going to go ahead and perform the corneal light reflex. So just go ahead and stare at my nose for me, please. Okay, good. The light did reflect off the same spot in each eye, which is what we're looking for. So that's good. There's no, and your pupils were still there. Okay, good. Now I'm going to go ahead and do the 6-position diagnostic test. So just follow your eyes with my pen only. Or don't move your head or your neck. Okay, good. Eye movement was parallel, which is what we're looking for. So with this test and the previous test, cranial nerves 3, 4, and 6 are intact. Okay, now I'm going to do a pupillary light reflex test. So just stare straight ahead at the wall for me. I'm going to come in at a 15-degree angle. Okay, So pupils that constrict in each eye symmetrically in reaction to the light, so that is good. And now I'm going to do accommodations. I'm going to just have you stare at my nose for me, please. And when I bring my pen into focus, just focusing on that. Okay, good. Your pupils that constrict asymmetrically and equally, and in response to accommodating to the pen light, which is good. There was no deviation noted there. So with this test and the previous test, cranial nerves 2 and 3 are intact. And now I'm just going to do a quick cover test. So I'm just checking for any deviations. Okay, you had a steady fixed gaze, so that's good. No deviations noted. Alrighty, and with now I'm going to go ahead and inspect your internal structures. Okay, so I'm going to come in at a 15-degree angle. Red reflex is present, optic disc is creamy yellow, retinal arteries and vessels are present. Okay, now the other eye. Red reflex is present, optic disc is creamy yellow, and retinal arteries and vessels are present. Alright, and with that being said, I did notice that your pupils were round, equal, and reacted to light.
Next, I'm going to go ahead and inspect your conjunctiva. Okay, so I'm going to have to touch you again. All right. And here, I see that I don't see any signs of any redness or lesion, and as well as the other visual component of this exam. I don't see any signs of jaundice. Your eyes appear to be reactive and symmetrical in terms of their movements. Okay, so next I'm going to go ahead and do an examination of your pupillary response. Okay, so first I'm going to do the normal pupillary response as well as the consensual in your other eye. Okay, and while I'm doing this, I'm just going to look straight at that that Purell sign over there. Okay, so again in your left eye this time, normal, and then consensual. Okay, very good. Next I'm going to check the right eye. Not with this, with my otoscope. Good. Okay. Okay, now I'm gonna make sure that your eyes are responding correctly, giving the red eye response in both eyes. They do, very good. Next, I'm going to go ahead and check your retinas. Okay, so if you don't mind, again, just keep on staring directly ahead of that Purell and come in from the. Is the right side? So I'm coming in from my right side. Getting a good look and focusing as I go in closer and closer. Okay, very good. And again on your left-hand side. All right. Okay, very good. Now I'm just going to do a quick examination of your lacrimal glands. Okay, so this time you don't have to, you can relax a little bit. I'm just going to do a quick visual inspection first, and seeing there, I don't see any signs of swelling or any sort of signs of inflammation, such as redness or any sign of lesions or anything like that. So next I'm going to go ahead and palpate. Okay. Is there any pain as I do this?
Mm-mm.
No? Okay, very good.
I'm just going to now look at your visual system. We're going to start with looking at your pupils in kind of medium dim light here.
First, inspect and compare both pupils. Pupil shape, position, and diameter should be equal on both sides. They should be round in shape. Pupillary constriction is best examined in dim background light.
So we're just going to look at the pupillary light reflex now. So I'm going to shine this in your eye.
The optic nerve carries sensory information back to the brainstem, and the oculomotor nerve carries motor information to pupillae constrictor muscles in both eyes. Contraction of these muscles constricts the pupils.
I'm going to move on now to the swinging light test. So again, just keep looking behind me.
This test allows us to check the relative strength of sensory signals being sent through each optic nerve. In a normal patient, the degree of pupillary constriction in both eyes is the same when the light is swung from one eye to the other eye. If one optic nerve has been damaged, the sensory signal traveling through that nerve will be weak. When light is shone into the eye on the damaged side, constriction of both pupils will be impaired, and both pupils will appear larger than they should. This weak constriction is only noticeable if you compare it to the robust pupil constriction in response to light being shone in the eye on the undamaged side. Keep your attention on only one pupil at a time, making sure that it constricts to the same size when the light is switched to the other eye.
Good. And there's no afferent pupillary defect. They constrict the first time every time, so that's normal. So we're going to move on to fundoscopy, where I'm going to look at the back of your eyes, okay? So just look off into the distance at the mark on the wall there, if you don't mind.
Using your right eye to examine the patient's right eye, first point the ophthalmoscope's light at the patient's eye and observe the red reflex. Slowly approach the patient's head from the side until you are quite close and looking through the pupil.
I'm going to look inside the other eye now. Keep looking at the back of the wall.
You can use your free hand to hold the patient's eye open or to steady yourself on their forehead or shoulder. Once you see the back of the eye, adjust the lens selector to bring the fundus into focus. Only a small portion of the retina will be visible through the ophthalmoscope. First, find a blood vessel and follow it medially until you come to the optic disc. Inspect each disc carefully for bulging, blurred margins, pallor, and enlargement. Inspect the blood vessels and see if you can visualize the macula.
So we're going to check your visual fields now. I'm going to start with the central visual field. So I'd like you to take your hand and cover your eye like this. And when you look at my face, is any part of it blurry?
No.
And you can see the whole face there?
Yes.
Good. And can you cover your other eye like that? Excellent. And again, you can see the whole face, and none of it looks blurry to you right now?
No.
Perfect. Okay. So we're going to move on to look at your peripheral visual fields using the counting fingers method. So I'd like you to cover your eye here and make sure you're still just looking at the bridge of my nose. I'm going to show you 1 or 2 fingers. Tell me how many you see. Okay?
1, 2.
Position yourself at arm's length away from the patient at eye level. Place your hands midway between yourself and the patient.
2.
Close one eye so that your open eye is on the same side as the patient's. Make eye contact.
1.
Now that your and your patient's visual fields are aligned, assess the patient's peripheral vision by placing your fingers in your own peripheral vision.
So normal visual fields centrally and peripherally, that's all good.
I want you to put your chin here before against there. I want you to look at my ear here. And what we're doing here is actually looking at the front part of her eye, your cornea, which is the clear part of the front of your eye, your lids, the white part of your eye, your iris, and we're able to look at your lens a little bit on the inside. Go ahead and look up for me. And look down. Look to the right. Look to the left. Look at my ear here. Good. I'm going to sit back.
And what I'm going to do is have my hands behind your head and then bring them into your field of view, and I'd like you to let me know when you can see them, okay? So I'm going to have you stare just at the bridge of my nose here while we do this.
Okay.
And which one's wiggling?
That one.
Good. One more time.
Yep.
And which one's wiggling?
That one.
Great. So visual fields are intact in all 4 quadrants. And on inspection of James's eyes, the eyelids are without ptosis, entropion or ectropion. The sclera are white without erythema. And James, I'll have you just look up with your eyes. And conjunctiva are pink. Next, we're going to take a look at the lens. So James, just keep staring at the bridge of my nose here. Good, so no opacities or crescenteric shadows. And corneal reflection is symmetrical bilaterally. And James, just keep staring straight at the bridge of my nose here. Good, and if I can have you stare at the tip of my pen light, and then focus on the back wall, and back to the pen light, and back to the back wall. Great, so Perla DNC. And then James, if you can keep your focus on my pen light, and without moving your head at all, follow it with your eyes, Great, and you can relax for me. So cranial nerves 3, 4, and 6 are intact bilaterally, known as nystagmus, noted, and convergence also intact bilaterally. So next, James, is the ophthalmoscopic exam. So I'm going to be taking a look in your eyes. You'll see a bit of a bright light, and you'll feel the tip of this just touch your brow. But I'll try to be quick.
Okay.
So if I can have you just pick a spot on the back wall and stare at it for me. I'm just going to brace your head. Red reflex noted. There we go. And we're going to do that one more time on the other side. So again, stare at that back wall. Red reflex noted. Okay, great.
I'm now going to test your cranial nerves. First, going to look at your pupils. Just look straight ahead at my face and I'll shine a light in your eye. Now I'm going to test your vision. Look straight at my face and out of the corner of your eye, point to which hand is wiggling. Now I'd like you to look at my finger and follow it wherever it goes, but keep your head still. Just move your eyes.
And I want to shine a light on your eyes. If you look right straight at my nose. Okay, and look right straight at my nose again. Okay, good. And I want to have you follow my finger. Just with your eyes. Okay. Follow. Follow. There you go. All the way out here. It's nice and easy to see your pupils.
We are going to examine the patient's pupils. Using a pen light or muscle light, measure the diameter of both the patient's pupils in dim and bright light. The pupils should be equal, round, and reactive to light. Check the direct and consensual response to light by shining light in either eye. Check for pupillary constriction to accommodation by having the patient focus on a far object, then quickly to a near object and observing. Finally, with dim lights, using the swinging flashlight test to check for APD or a relative afferent pupillary defect. Next, we need to check the patient's extraocular movements. There are 3 cranial nerves that control the muscles for eye movement. Cranial nerves 3, 4, and 6. We can test their functioning by standing roughly 2 to 3 feet from the patient and having the patient follow your finger with their eyes. Hold out your hand with one finger up, instructing the patient to follow your finger with their eyes only, and keeping their head still. Start in the midline and draw the cardinal H in the air.
The most important part of performing a confrontational visual field exam is patient and examiner positioning and providing the patient with simple and concise directions. First, have the patient remove their glasses if they are wearing any, as glasses can create artificial field defects on exam. Both the patient and the examiner should be seated with their knees almost touching and their heads at equal heights. Positioning is important because you will basically be checking your own visual field against that of the patient, and if the 2 visual fields are not lined up symmetrically, the test is not accurate. Tell the patient to look at your nose and ask if any part of your face is missing. Next, hold both of your hands up on either side of the patient's face, making sure your hands are equidistant between yourself and the patient. tell the patient to look at your nose and ask how many hands they see. Finally, ask the patient to cover their right eye while you close your left eye. Instruct the patient to continue to stare at your nose while you proceed to hold up 1, 2, or 5 fingers in each of the 4 quadrants of their visual field, asking them how many fingers they see. If the patient's eyes start to wander around, simply instruct them to keep staring at your nose and repeat the exam for that quadrant. Repeat this procedure for the other eye as well. The retina exam is best done after giving the patient dilating eye drops. However, these drops are not always available in the primary care or emergency setting. If they aren't available, it is important to do the exam with the room lights turned off or dimmed so as to avoid pupillary constriction, which would make the exam more difficult. First, have the patient remove their glasses if they are wearing any. You should also remove your own glasses. To check the patient's red reflex, dial the focus on the ophthalmoscope to 0 and stand roughly arm lengths away. Looking through the ophthalmoscope, swing the light source back and forth between the patient's eyes to compare the red reflex. Next, we will demonstrate how to examine the patient's retina. When examining the patient's left eye, hold the ophthalmoscope in your left hand and use your own left eye. The opposite should be done with the patient's right eye. Adjust the size of the light source accordingly. Instruct the patient to focus on an object across the room. Starting slightly temporally and about a foot from the patient's face, slowly move in, keeping the red reflex in view. You should end up pretty close to the patient's face, roughly a few inches. Start by looking for the optic disc, which is slightly nasal on the retina. If you are having trouble finding the disc, locate a blood vessel and trace it back until you find the disc. Next, examine the peripheral retina. Finally, examine the macula, or the center of vision. This should be done by instructing the patient to look directly into the light, and should be done last because it can be irritating to the patient.
To look right at my nose.
Okay.
Okay, great. And I want you to just look straight ahead at me. Great. Just going to shine this light from the side. Okay. All right, I just want you to look at my finger and watch as it comes in toward you. I'm going to make you cross-eyed. Okay, very good. And now I'd like you to look at a point at the door over there and just focus on that. And now look at my finger. Very good. And look back at the door. Okay, great. I'm just going to check your tear glands there and here. Very good. All right. Normally we would turn the lights off for this part of the exam, but for purposes of demonstration we're going to leave them on. Okay, Mr. Allen, I'd like you to just look at the distant point over there, and I'm going to be shining this light in your eye. Just try and hold your head still for me. Okay, very good. Now I'm going to do the same thing on the other side.
Same point?
Same point.
I'd like to examine the back of your eyes now, if that's okay. Yeah? So I'm going to shine this bright light, and I'm coming quite close to you, but I'm not going to touch you with this fundoscope. It might be uncomfortable with the light, but it shouldn't hurt. If you want me to pause, then that's fine. So the first thing I want you to do, if you don't mind, just focus on a distant point over there, maybe this yellow box over there. Yeah?
Mm-hmm.
That's fine. And now I'm going to come quite close to you. Look straight at the light. Very good. And now look straight ahead as you were doing before. What I'd like you to do now is to look up for me. And now look to the right. Look to your left. And now look at the bottom. I'll just lift your eyelids. Thank you. We'll just move to the other eye now. And again, if you look at a distant point over there. Thank you. Look at the light for me. And now look straight again. Can you look up? Look to your right. And to your left. And down below. I'm going to lift your eyelids. Thank you.
I'm just going to test your pupils if that's okay. Yep. So I want you to just keep looking straight ahead in the distance for me. I'm just going to come up close with a light. It doesn't hurt in any way. Okay. Okay. Now I'm going to get you to just look right at the distance.
Yep.
And now look at my finger. Okay, brilliant. Right, I'm going to look at the back of your eyes now. So I'm going to use this. I'm going to come very close. Bright light, but it doesn't hurt you in any way. Okay. So keep looking in the distance. Yep. Okay. Okay, and can you look towards me? And if you look up, look down, look to the right, and look to the left. Okay, brilliant. Going to do exactly the same, but coming in the different side. So keep looking in the distance. Okay, can you look towards the light, please? Okay, and can you look up? And look down. And look to the right. And look to the left.
Now inspect your pupils, which are round. Is it okay if I pull down your lower lids? Yep. Alright, that is to inspect your conjunctiva. It is to see if it's pink and moist, which it is. Okay, I'm going to now check your pupil constriction. I'm going to do this by shining a light in your eye twice. I'm going to start with your left eye, and then I'm going to move on to your right, okay? Here we go. One, and again, and the other side, okay, and again. Very good. Okay, I'm going to have you look at face forward, but follow the pen with your eyes. Very good. Pupils are equal, round, reactive to light and accommodations.
Open your eyes up.
See the red reflex. All the blood vessels look normal. Macula and disc look normal in the left eye. Okay. And the same for the right eye. Open your eyes up for me. Jot those moist pink. Okay. Shine light in your eye. Okay. Okay. Pupils equally reactive to light. Okay. I want you to follow the